Good morning. This is Dr. John Ventura. And this morning I'd like to talk to you for a couple of minutes about why it's important the chiropractic profession move into a patient-centered, evidence-based model that is condition-based. All the messages that we provide you aren't going to be to pump you up and make you feel good. Sometimes we have to face a harsh reality so that we're going to be pushed into making a change that we need to make. Let's look at the utilization of chiropractic services over the past 50 years. They started tracking utilization back in the 60s to 70s and have done so every decade since then. Utilization started at about 8% of the population. It's never varied more than 1 or 2%. I think we reached a peak of around 10%, but currently it's actually below 8% at about 7.8% of the population utilizing your services. So in spite of some 50 years of yellow page advertisements, of talking to the public, of trying to get our message out in many different ways, our utilization hasn't changed. Secondly, let's look at 3 surveys that have been done to look at the public's trust of professions. If you look at within that ranking all the healthcare professions, nurses scored the highest. Chiropractors scored the lowest. We did score higher than the lawyers, but we have scored the lowest of all the healthcare professions that have been looked at. Now let's look at the default rate on student loans. Of all the healthcare professions, again, the highest default rate seems to be among chiropractic graduates. These are some harsh realities that we need to face. Those are the situations that we need to change, and I firmly believe that we can change that by getting our profession to move into a patient-centered, evidence-based model that is condition-based. The company that I'm affiliated with, IHCPR, Integrative Healthcare Practice Resources, will be putting on a program November 20th in Waltham, Massachusetts. The purpose of our program is to help you brand your image, to get that image out to the public, and to show you some different models of care that are more integrated into the mainstream of healthcare. This isn't about selling out who you are. This is about embracing who you are and providing a service to the public that is patient-centered and evidence-based. I would encourage you to go to IHCPR.com and look up the seminar that we'll be putting on November 20th. You can also go to your Facebook page and search IHCPR, and we have information about the program on our Facebook page too. I'd encourage you to please follow up with either of those 2 sources of information, and please consider attending our program November 20th. Thanks very much.